Medical Destiny uploads educational and informational videos related to health and medical topics. If you would like to get such kinds of videos, kindly subscribe our channel.
Nclex-Rn exam questions with answers. (476). A nurse manager has identified a problem on the nursing unit and holds unit meetings for all shifts. The nurse manager presents an analysis of the problem and proposals for actions to team members and invites the team members to comment and provide input. Which style of leadership is the nurse manager specifically employing? 1. Situational. 2. Laissez-faire. 3. Participative. 4. Authoritarian. Answer: 3. Rationale. Participative leadership demonstrates an in-between style, neither authoritarian nor democratic. In participative leadership, the manager presents an analysis of problems and proposals for actions to team members, inviting critique and comments. The participative leader then analyzes the comments and makes the final decision. The situational leadership style uses a style depending on the situation and events. A laissez-faire leader abdicates leadership and responsibilities, allowing staff to work without assistance, direction, or supervision. The autocratic style of leadership is task-oriented and directive. 477. A physician prescribes 1000 milliliters of half% normal saline solution to run over 8 hours. The drop factor is 15 drops per milliliter. The nurse plans to adjust the flow rate to how many drops per minute to safely administer this intravenous solution? Round answer to the nearest whole number. Dash drops per minute. Answer: 31. Rationale. The prescribed 1000 milliliters is to be infused over 8 hours. Follow the formula for calculating 4 flow rates and multiply 1000 milliliters by 15. Then divide the result by 480 minutes. The infusion is to run at 31.2 or 31 drops per minute. Formula given below. 478. A client asks the home care nurse to witness the client's signature on a living will with the client's attorney in attendance. Which should the nurse implement? 1. Decline to witness the signature on the living will. 2. Sign the living will as a witness to the signature only. 3. Notify the supervisor that a living will is being witnessed. 4. Sign the living will with identifying credentials and employment agency. Answer: 1. Rationale. Living wills are written documents and need to be signed by the client. The client's signature either must be witnessed by non-agency individuals or notarized. Thus the nurse should decline to sign the will to avoid a conflict of interest. The nurse's signature on the living will testifies to the validity of the client's signature. If the nurse contacts the supervisor should advise the nurse to decline. Therefore options 2, 3, and 4 are incorrect. 479. The nurse notes old and new ecchymotic areas on an older adult client's arms and buttocks upon admission. The client tells the nurse in confidence that her family members frequently hit her. Which statement should the nurse use in response? 1. I have a legal obligation to report this type of abuse. 2. Let's get these treated and I will maintain confidence. 3. Let's talk about ways to prevent someone from hitting you. 4. If this happens again, you must call the emergency department. Answer: 1. Rationale. The nurse should inform the client that nurses cannot maintain confidence about alleged abusive behavior and that the nurse must report situations related to abuse. The nurse avoids bargaining with the client about treatment to maintain a confidence that the nurse is legally bound to report. Options 3 and 4 delay protective action and place the client at risk for future abuse. 480. At the scene of a train crash, the nurse triages the victims. Which clients would be coded for triage as most urgent or the first priority? Select all that apply. Victims. 1. Is dead. 2. Has chest pain. 3. Has a leg sprain. 4. Has a chest wound. 5. Has multiple fractures. 6. Has full thickness burns over 30% of the body. Answer: 2, 4, 6. Rationale: in a disaster situation, saving the greatest number of lives is the most important goal. During a disaster, the nurse would triage the victims to maximize the number of survivors and sort the treatable from the untreatable victims. Prioritizing victims can be done in many ways, and many communities use a color coding system. First priority victims have life-threatening injuries and are experiencing hypoxia or near hypoxia. Examples of injuries in this category are shock, chest wounds, internal hemorrhage, head injuries producing loss of consciousness, partial or full thickness burns over 20% of the body surface, and chest pain. Second priority victims have injuries with systemic effects but are not yet hypoxic or in shock and can withstand a 2-hour wait without immediate risk. Third priority victims have minimal injuries unaccompanied by systemic complications and can wait for more than 2 hours for treatment without risk. Leg sprain. Dying or dead victims have catastrophic injuries, and the dying victims would not survive under the best of circumstances. 481. A client tells the home care nurse of a personal decision to refuse external cardiac resuscitation measures. Which of the following is the most appropriate initial nursing action? 1. Notify the physician of the client's request. 2. Discuss the client's request with the client's family. 3. Document the client's request in the home care nursing care plan. 4. Conduct a client conference with the home care staff to share the client's request. Answer: 1. Rationale: external cardiac resuscitation is a life-saving treatment that a client may refuse. The most appropriate initial nursing action is to notify the physician, because a written do not resuscitate order from the physician is needed to ensure that the client's wishes are followed. The DNR order must be reviewed or renewed on a regular basis per agency policy. Although options 2, 3, and the fourth may be appropriate, remember that obtaining a written physician's DNR order must be completed first. 482. The nurse prepares a client for discharge who needs intermittent antibiotic infusions through a peripherally inserted central catheter line. Which should the nurse include in client teaching about daily infusion care in the home? 1. Keep the affected arm immobilized. 2. Aspirate 3 milliliters of blood from the PICC line. 3. Maintain a continuous intravenous infusion. 4. Check the insertion site for redness and swelling. Answer: 4. Rationale: a peripherally inserted central catheter is designed for long-term intravenous infusions and, usually, is inserted into the median cubital vein with the terminal end of the catheter in the superior vena cava. Although the risk of infection is less with the peripherally inserted central catheter line than with the central venous catheter, it is possible for phlebitis or infection to develop. Clients must inspect the insertion site and affected arm daily and report any discharge, redness, swelling, or pain to the nurse or provider immediately. A peripherally inserted central catheter line does not require the affected arm to be immobilized and can be used for intermittent or continuous fluid infusion. Although a peripherally inserted central catheter line can be used to obtain a blood specimen, the risk of occlusion from aspirating blood as part of the related daily care is greater than any potential benefit. 483. The nurse is preparing the client assignment for the day and needs to assign clients to a licensed practical nurse and a nursing assistant. Which clients should the nurse assign to the LPN because of client needs that cannot be met by the nursing assistant? Select all that apply. 1. A client requiring frequent suctioning. 2. A client requiring a dressing change to the foot. 3. A client requiring range of motion exercises twice daily. 4. A client requiring reinforcement of teaching about a diabetic diet. 5. A client on bed rest requiring vital sign measurement every 4 hours. 6. A client requiring collection of a urine specimen for urinalysis testing. Answer: 1, 2, 4. Rationale: delegation is the transferring to a competent individual the authority to perform a nursing task. When the nurse plans client assignments, he or she needs to consider the educational level and experience of the individual and the needs of the client. The LPN is trained to perform all the tasks indicated in the options. The clients who have needs that cannot be met by the nursing assistant are those requiring suctioning, a dressing change, and reinforcement of teaching about a diabetic diet. A nursing assistant is trained to perform range of motion exercises, measure vital signs, and collect a urine specimen. 484. A charge nurse observes that a staff nurse is not able to meet client needs in a reasonable time frame, does not problem-solve situations, and does not prioritize nursing care. The charge nurse has the responsibility to 1. Supervise the staff nurse more closely so that tasks are completed. 2. Ask other staff members to help the staff nurse get the work done. 3. Provide support and identify the underlying cause of the staff nurse's problem. 4. Report the staff nurse to the supervisor so that something is done to resolve the problem. Answer: 3. Rationale: Option 3 empowers the charge nurse to assist the staff nurse while trying to identify and reduce the behaviors that make it difficult for the staff nurse to function. Options 1, 2, and 4 are punitive actions, shift the burden to other workers, and do not solve the problem. 485. A registered nurse is a preceptor for a new nursing graduate and is observing the new nursing graduate organize the client assignment on daily tasks. The registered nurse intervenes if the new nursing graduate does which of the following? 1. Provides time for unexpected tasks. 2. Lists the supplies needed for a task. 3. Prioritizes client needs and daily tasks. 4. Plans to document task completion at the end of the day. Answer: 4. Rationale: the nurse should document task completion continuously throughout the day. Options 1, 2, and 3 identify accurate components of time management. 486. A registered nurse is a preceptor for a new nursing graduate and is describing critical paths and variance analysis to the new graduate. The registered nurse instructs the new nursing graduate that a variance analysis is performed on all clients. 1. Continuously. 2. Daily during hospitalization. 3. Every third day of hospitalization. 4. Every other day of hospitalization. Answer: 1. Rationale: variance analysis occurs continually as the case manager and other caregivers monitor client outcomes against critical paths. The goal of critical paths is to anticipate and recognize negative variance early so that appropriate action can be taken. A negative variance occurs when untoward events preclude a timely discharge and the length of stay is longer than planned for a client on a specific critical path. Options 2, 3, and 4 are incorrect. 487. When a nurse manager makes decisions regarding the management of the nursing unit without input from the staff, the type of leadership style that the nurse manager is demonstrating is 1. Autocratic. 2. Situational. 3. Democratic. 4. Laissez-faire. Answer 1. Rationale. The autocratic style of leadership is task-oriented and directive. The leader uses his or her power and position in an authoritarian manner to set and implement organizational goals. Decisions are made without input from the staff. The situational leadership style uses a style depending on the situation and events. Democratic styles best empower staff toward excellence because the style of leadership allows nurses to provide input regarding the decision-making process and an opportunity to grow professionally. The laissez-faire style allows staff to work without assistance, direction, or supervision. 488. A hospital administrator has implemented a change in the method of assigning nurses to client care units. Nurses will now be required to work in other nursing departments and will not be specifically assigned to a client care unit. A group of registered nurses is resistant to the change, and the nursing administrator anticipates that the nurses will not facilitate the process of change. Which of the following would be the best approach on the part of the administrator in dealing with the resistance? 1. Ignore the resistance. 2. Exert coercion with the nurses. 3. Manipulate the nurses to participate in the change. 4. Confront the nurses to encourage verbalization of feelings regarding the change. Answer 4. Rationale. Confrontation is an important strategy to meet resistance head-on. Face-to-face meetings to confront the issue at hand will allow verbalization of feelings, identification of problems and issues, and the development of strategies to solve the problem. Option 1 will not address the problem. Option the second of may produce additional resistance. Option the third of may provide a temporary solution to the resistance but will not specifically address the concern. 489. A registered nurse in charge of the client care unit is preparing the assignments for the day. The RN assigns a nursing assistant to make beds and bathe one of the clients on the unit and assigns another nursing assistant to fill the water pitchers and serve juice to all of the clients. Another RN is assigned to administer all medications. Based on the assignments designed by the RN in charge, which type of nursing care is being implemented? 1. Team nursing. 2. Primary nursing. 3. Functional nursing. 4. Exemplary nursing. Answer 3. Rationale. The functional model of care involves an assembly line approach to client care, with major tasks being delegated by the charge nurse to individual staff members. Team nursing is characterized by a high degree of communication and collaboration between members. The team is generally led by a registered nurse, who is responsible for assessing, developing nursing diagnoses, planning, and evaluating each client's plan of care. In primary nursing, concern is with keeping the nurse at the bedside actively involved in care, providing goal-directed and individualized client care. In an exemplary model of team nursing, each staff member works fully within the realm of educational and clinical experience in an effort to provide comprehensive individualized client care. Each staff member is accountable for client care and outcomes of care. 490. The nurse is receiving a client being transferred from the post-anesthesia care unit following an above-the-knee amputation. The nurse should take which action to safely position the client at this time? 1. Elevate the foot of the bed. 2. Put the bed in reverse Trendelenburg. 3. Position the residual limb flat in the bed. 4. Keep the residual limb flat with the client lying on the operative side. Answer 1. Rationale. Edema of the residual limb is controlled by elevating the foot of the bed for the first 24 hours only after surgery. After the first 24 hours, the residual limb is usually placed flat on the bed to reduce hip contracture. Edema is also controlled by residual limb wrapping techniques. Reverse Trendelenburg does not provide direct limb elevation. 491. An emergency department nurse is a member of an all-hazards disaster preparedness planning group. The group is developing a specific emergency response plan in the event that a client with smallpox arrives in the emergency department. Which interventions should be included in the plan? Select all that apply. 1. Isolate the client. 2. Don protective equipment immediately. 3. Notify infectious disease specialists, public health officials, and the police. 4. Lock down the emergency department and the entire hospital immediately. 5. Identify all client contacts, including transport services to the emergency department and clients in the waiting room. 6. Administer smallpox vaccines to all hospital staff, client contacts, and clients sitting in the emergency department waiting room immediately. Answer: 1, 2, 3, 5. Rationale: an all-hazards disaster preparedness group is a multifaceted internal and external disaster preparedness group that establishes action plans for every type of disaster or combination of disaster events. In the event of emergency department exposure to a communicable disease such as smallpox, the client would be isolated immediately and the staff would immediately don protective equipment. The emergency department would be locked down immediately. Infectious disease specialists and public health officials will determine whether it is necessary to lock down the entire hospital. Infectious disease specialists, public health officials, and the police are notified. All client contacts, name, addresses, telephone numbers, including transport services to the emergency department and clients in the waiting room, would be identified so that the public health department can follow through on notifying and treating these individuals appropriately. Although getting the vaccine within 3 days after exposure will help prevent the disease or make it less severe, it is unreasonable and unnecessary to administer smallpox vaccines to all hospital staff, client contacts, and clients sitting in the emergency department waiting room. 492. A pregnant client tests positive for the hepatitis B virus. The client asks the nurse if she will be able to breastfeed the baby as planned after delivery. The nurse should make which response to the client? 1. You will not be able to breastfeed the baby until 6 months after delivery. 2. Breastfeeding is not advised, and you should seriously consider bottle feeding the baby. 3. Breastfeeding is not a problem, and you will be able to breastfeed immediately after delivery. 4. Breastfeeding is allowed if the baby receives prophylaxis at birth and remains on the scheduled immunization. Answer: 4. Rationale: the pregnant client who tests positive for hepatitis B virus should be reassured that breastfeeding is not contraindicated if the infant receives prophylaxis at birth and remains on the schedule for immunizations. Therefore, options 1, 2, and 3 are incorrect. 493. A nurse manager is planning to implement a change in the method of the documentation system for the nursing unit. Many problems have occurred as a result of the present documentation system, and the nurse manager determines that a change is required. The initial step in the process of change for the nurse manager is which of the following? 1. Plan strategies to implement the change. 2. Set goals and priorities regarding the change process. 3. Identify the inefficiency that needs improvement or correction. 4. Identify potential solutions and strategies for the change process. Answer: 3. Rationale: when beginning the change process, the nurse should identify and define the problem that needs improvement or correction. This important first step can prevent many future problems, because, If the problem is not correctly identified, a plan for change may be aimed at the wrong problem. This is followed by goal setting, prioritizing, and identifying potential solutions and strategies to implement the change. 494. A delivery room nurse is preparing a client for a cesarean delivery. The client is placed on the delivery room table and the nurse positions the client 1. In the prone position. 2. In semi-Fowler's position. 3. In Trendelenburg's position. 4. In the supine position with a wedge under the right hip. Answer 4. Rationale, vena cava and descending aortic compression by the pregnant uterus impedes blood return from the lower trunk and extremities, therefore decreasing cardiac return, cardiac output, and blood flow to the uterus and subsequently the fetus. The best position to prevent this would be side-lying with the uterus displaced off the abdominal vessels. Positioning for abdominal surgery necessitates a supine position, so a wedge placed under the right hip provides displacement of the uterus off of the vena cava. A semi-Fowler's or prone position is not practical for this type of abdominal surgery. Trendelenburg positioning places pressure from the pregnant uterus on the diaphragm and lungs, decreasing respiratory capacity and oxygenation. 495. A nurse in the daycare center is told that a child with autism will be attending the center. The nurse collaborates with the staff of the daycare center and plans activities that will meet the child's needs. The priority consideration in planning activities for the child is to ensure 1. Safety with activities. 2. That activities provide verbal stimulation. 3. Social interactions with other children in the same age group. 4. Familiarity with all activities and providing orientation throughout the activities. Answer 1. Rationale. The child with autism is unable to anticipate danger, has a tendency for self-mutilation, and has sensory perceptual deficits. Safety with activities is a priority in planning activities with the child. Although verbal communications, social interactions, and providing familiarity and orientation are also appropriate interventions, the priority is safety. 496. A registered nurse is reviewing a plan of care developed by a nursing student for a child who is being admitted to the pediatric unit with a diagnosis of seizures. The registered nurse determines that the student nurse needs to revise the plan of care if which incorrect intervention is documented. 1. Maintain the bed in a low position. 2. Restrain the child if a seizure occurs. 3. Pad the side rails of the bed with blankets. 4. Place the child in a side-lying lateral position if a seizure occurs. Answer 2. Rationale. Restraints are not to be applied to a child with a seizure because they could cause injury to the child. The side rails of the bed are padded with blankets, and the bed is maintained in low position to provide safety in the event that the child has a seizure. Positioning the child on his or her side will prevent aspiration as the saliva drains out of the child's mouth during the seizure. 497. A deceased client with multiple gunshot wounds arrives by ambulance to the emergency department. The nurse is caring for the client's personal belongings, which may be needed as legal evidence. Which actions should the nurse take to properly secure and handle legal evidence? Select all that apply. 1. Place paper bags on the hands and feet. 2. Give the clothing and wallet to the family. 3. Cut clothing along the seams, avoiding bullet holes. 4. Collect all personal items, including items from clothing pockets. 5. Place wet clothing and personal belongings in a labeled, sealed plastic bag. 6. Do not allow family members, significant others, or friends to be alone with the client. Answer 1, 3, 4, 6. Rationale. basic rules for securing and handling evidence include minimally handling the body of a deceased person, placing paper bags on the hands and feet and possibly over the head of a deceased person, protects trace evidence and residue, placing clothing and personal items in paper bags. Plastic bags can destroy items because items can sweat in plastic, cutting clothes along seams, avoiding areas where there are obvious holes or tears, and collecting all personal items, including items from clothing pockets. Evidence is never released to the family to take home, and family members, significant others, or friends are not allowed to be alone with the client because of the possibility of jeopardizing any existing legal evidence. 498. A nurse receives a telephone call from the emergency department and is told that a child with a diagnosis of tonic-clonic seizures will be admitted to the pediatric unit. The nurse prepares for the admission of the child and instructs the nursing assistant to place which items at the bedside. 1. A tracheotomy set and oxygen. 2. Suction apparatus and an airway. 3. An endotracheal tube and an airway. 4. An emergency cart and laryngoscope. Answer: 2. Rationale: tonic-clonic seizures cause tightening of all body muscles followed by tremors. Obstructed airway and increased oral secretions are the major complications during and after a seizure. Suction is helpful to prevent choking and cyanosis. Options 1 and 3 are incorrect because inserting an endotracheal tube or a tracheostomy is not done. It is not necessary to have an emergency cart, which contains a laryngoscope, at the bedside, but a cart should be available in the treatment room or on the nursing unit. 499. The nurse is admitting a 56-year-old client with exacerbation of chronic obstructive pulmonary disease to the hospital and questions the client as to whether he has received previous immunization for pneumococcal pneumonia. The client replies that he received the vaccine 6 years ago. Which of the following is essential to include in the plan of care during the client's hospital admission? 1. Offer revaccination to the client. 2. No further nursing action is needed. 3. Document the previous immunization on the client record. 4. Explain to the client that he can only be revaccinated during the fall months. Answer: 1. Rationale: during the history-taking of a client with a respiratory disorder, the nurse should ask if the client had been previously vaccinated for influenza and had received pneumococcal pneumonia vaccine. The pneumococcal pneumonia vaccine is administered any time during the year. Revaccination is currently advised in a client with COPD if the client received the vaccine more than 5 years previously and if the client was younger than 65 years of age at the time of vaccination. Options 2 and 4 are incorrect. Although documentation would be done, this is not the essential action. 500. The nurse in a well baby clinic is providing safety instructions to the mother of a 1-month-old infant. Which safety instruction is most appropriate at this age? 1. Lock up all poisons. 2. Cover electrical outlets. 3. Never shake the infant's head. 4. Remove hazardous objects from low places. Answer: 3. Rationale: the age-appropriate instruction that is most important is to instruct the mother not to shake or vigorously jiggle the baby's head. Options 1, 2, and 4 are important instructions to provide to the mother as the child reaches the age of 6 months and begins to explore the environment.
Thanks for watching. If you like this video and you would like to watch similar videos in future, please subscribe our channel and tap the bell icon.